Welcome back. I'm Steve Adubato. We're now joined by Mr. Bob Garrett, who is the CEO of Hackensack Meridian Health. Good to see you, Bob.
Good to see you. Thanks for having me, Steve.
Bob, lay this out for folks. Hackensack, the first case of COVID-19 in the state?
Yeah, back in on March 4th, it seems like years ago, 7 weeks ago. And, after that first case came, of course, there was a huge ramp up of cases. And, the good news is we were prepared, but, you never can totally prepare for something so unprecedented. In my lifetime, I've never been through any of this. I think nobody really has, and being on the front lines of healthcare, my entire career, we've had to respond to other emergencies, Hurricane Sandy. We had the Ebola scare and the Ebola crisis, but nothing compared to COVID-19, just because of the numbers and the speed of which things happened and changed was really unprecedented.
Let me follow up on this. I want to be clear so people understand Hackensack Meridian Health is a system. And I know, and let me disclose, I've done leadership development, particularly for physicians, and talk about how physicians and their leadership, their job has changed, people on the front lines. And also HMH is one of the hospital systems supporting what we do. Bob, let me ask you, there are 14 hospitals within Hackensack Meridian Health, but you also have other health care related affiliates, correct?
Yeah, so we actually are up to 17 hospitals now, part of Hackensack Meridian, 14 nursing homes that long-term care facilities that we own, and of course that's been a major issue during this pandemic. But we have a host of other healthcare providers. We have physicians' offices, we have urgent care centers, surgery centers. Really the full continuum of care. So we're located in 500 different locations throughout the state of New Jersey. And even in terms of preparing for this pandemic, we had to prepare all of those sites. So it wasn't just the hospitals, but it was really a system-wide preparation that went on.
Let's talk about longer term, because if you want to check out, folks, if you want to check out what's happening day by day, Governor Murphy's press conferences, go to NJTV News, our colleagues at WNET as well with Metro Focus, check them out every day. We're looking at, dare I say, the longer term challenges. Bob Garrett, the long-term implications for hospitals, hospital systems, and the healthcare world, what do you see?
So I certainly see healthcare being delivered a lot differently. So if you're a patient coming into our health network or most health networks now, you're gonna face a different type of a care delivery experience. So as an example, in order for us to really get ready for the return of a lot of non-COVID patients, because we've been taking care of so many COVID patients over the last 7 weeks. We've taken a lot of steps, Steve. We have, as an example, every person that comes into our facilities gets their temperature checked. There are designated spaces for COVID and non-COVID. We've had to go through thorough cleaning processes. We're testing all patients coming in. We're testing many of our team members as well. So it's a different experience. And one of the things that they're gonna find is the idea of waiting in waiting rooms, for outpatients, I think are going to be a thing of the past, because there has to be social distancing. So you're going to be actually called on your cell phone to come in when your appointment is ready, and you come right in from your car. You get your procedure, you get your test, and then if you need to leave, you leave at that point. But you don't interact with many people. So the world of healthcare delivery is going to change. Another element is telehealth.
Right.
And we saw during this pandemic, telehealth really blossomed. People were receiving healthcare through telehealth, and we're actually, in our medical group, which we have about 1,100 providers in our medical group, we're actually almost doing the volume of patient visits as we did prior to the pandemic, but about half of them are being done through telehealth now. I think that change will be permanent. Another change is many of our team, we have 36,000 team members. Not all of them are on the front line. Some of them work behind the scenes in information technology and finance and support functions. I think many of those people who have been working from home will continue to work from home. So I think that whole telecommuting trend is going to continue. But there's no doubt that this crisis, this pandemic, has taken a big toll on hospitals. Not just our infrastructure. Obviously, we had order supplies and personal protective equipment in record numbers. We had to expand our capacity like we've never done before. Steve, we actually had to triple our intensive care capacity in a matter of days and weeks. And one interesting story is up at Hackensack University Medical Center. Literally within a couple of days, we were able to transform what was the cafeteria into a 72-bed COVID-19 unit. And kudos to our construction and plant operations folks. They did just a great job in a short period of time. So there is really, there really is a new norm here, and there's no doubt that this has taken its toll on our infrastructure, but it's also taken a financial toll on the healthcare industry. And there's a big road ahead of us to have to recover. Certainly, from a financial perspective, revenues are down and expenses are way up to be able to take care of patients during this pandemic. And we have to keep it that way because, there's a lot of predictions that we're going to get that second wave. So we need to make sure our healthcare system is as strong as possible from an infrastructure perspective and also from a financial perspective.
The plasma transfusion therapy, what is it and why is it so significant? Because I know that the folks over at CDI, which stands for the Center for Discovery and Innovation, right?
Right.
Are they driving that with Dr. Perlin?
Yeah, they really are, Steve. So this is really exciting. First of all, what a great story. So inspirational to see literally thousands of people who have recovered from COVID-19 donate their blood, their plasma, their antibodies to be helping patients who are now suffering with COVID-19. We've already done over 450 of these plasma infusions, and the early evidence is very, very hopeful. Again, we still don't have enough data to form any conclusions, but it really, anecdotally, if you talk to our clinicians on the front line, you talk to folks like Dr. Perlin, who developed a serum that would be able to be infused with the plasma into patients who are sick. They're all very, very positive and optimistic about our early results. So keeping our fingers crossed, because as we all know, there's no vaccine yet. And this is one of the more hopeful therapies that have come out over the last 6 weeks or so.
You've been listening to Bob Garrett. I'm Steve Adubato remotely. He is remote as well on Zoom. I want to thank Bob Garrett, who is the CEO of Hackensack Meridian Health, for joining us. Bob, stay well, stay safe, and particularly to the physicians, nurses, and all the frontline folks. They are the true heroes, as you said, and many have said many times. Thank you, Bob.
Thank you, Steve. I appreciate you having me.
You got it. We'll be right back right after this.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, Horizon Blue Cross Blue Shield of New Jersey, PSE&G, Gibbons PC, the Port Authority of New York and New Jersey, the Northward Center, the New Jersey Economic Development Authority, Fedway Associates, Inc., Wells Fargo. And by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State. And by Employers Association of New Jersey. Promotional support provided by NorthJersey.com and Local IQ, and by ROINJ. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.